You're looking there at the Diamond Princess, and we spent so much time covering that cruise ship as it was docked in Yokohama, Japan, and the passengers on board under quarantine for weeks before. Some of them were allowed to fly home to Canada, and of course, as we know, some of the Canadians had to stay behind because they tested positive. 251 Canadians all told on board that Diamond Princess when coronavirus hit. And as we knew, we found out later that, a good number tested positive. What we heard yesterday from government officials that there are 54 Canadians who are still in 24 different facilities, 24 Japanese hospitals, and of that number, 43 of them are being hospitalized and treated and surveyed for coronavirus or related problems. 1 week ago, you heard the story of one of them in quite fantastic detail, and it was a story that much of the country was discussing because it was our first chance really to experience what the Canadians in quarantine in Japan are dealing with. And John Northcott, jump in here. I'm not sure who we're introducing first. John brought you his story, but here's the man who we're talking about, and it's Craig Lee, our Canadian on board that ship, and then, as we learned, had to be taken to that facility in 8 hours away from where you were on the cruise ship. And Craig is still there in hospital and joining us, both of us today. It's great to see you on our program, Craig, in person. Thank you for being our guest.
Thank you.
Oh, we're good. John's joining in. We've never done this together. This is going to be good.
I'm really looking forward to talking to Craig, though, because he's got quite the story.
He has quite the story. Our first question is basically, a week later since we first heard from you, Craig, how are you doing?
I'm asymptomatic. I don't have any fever. I don't have any lung problems. My temperature is normal. I have an appetite. I sleep well. I'm just fine.
That's fantastic. But they must be still watching you very closely. I mean, what are you going through as far as tests and that kind of thing?
Okay. Every day they take my temperature twice, and they take what's called the SpO2, and it's the oxygen content in your blood. Show how well your lungs are working. And I get 99 each time, which is as high as you can go. I've had 2 tests. I'm waiting for the results, and they are the CPR, which is poly chain reaction, and I need 2 of those negative tests in a row in order to be released from the hospital.
Okay, you still haven't had those yet?
I've had the test, but I'm getting the results hopefully in 2 days. The test were 4 days ago. It takes 2 or 3 days for them to go to the lab and then give me the results.
Okay, so that's good news. By the time you're on the weekend, maybe Craig will be getting out, John.
Yeah, let's hope so.
Yes.
What are you talked about the conditions there, that it isn't officially a hospital. How is day-to-day life there?
It's really quite comfortable. Unlike the ship, where we were confined to our rooms a lot, and we were given permission to go outside once a day for an hour at a certain time, I can wander the corridors of this hospital, the 5th floor only, anytime I want. Meals are brought to us, and they're the bento boxes. They're quite delicious. The staff are very friendly. When I go by the nurse at the station the first time, there were pajamas I could take, socks, underwear. 2 days ago, they had 4 boxes of donuts that we could have if we wanted. And I got one of our boxes contained a note from the kitchen staff. I want to read it to you.
Okay.
It said, We hope you get well soon and quickly return home. This is a very hard time for you. We stand beside you, from all the kitchen staff.
Wow.
That's pretty fantastic.
And it was in Japanese, and it was in English. These people are so supportive. The nurses have with them an iPad which has a translator on it. So if we want anything they don't understand, I speak into it, and then I get the answer from them through the computer.
So
it's pretty amazing.
There's not a communication
Everyone's
problem. We were
friendly, very happy.
Craig, I should just tell you, we were looking at pictures of, because you'd sent us some pictures of your bento boxes, the food that you were given, and that's great that you have a good appetite to be enjoying that, because that's better than some people would say of hospital food.
I've heard that. Yes.
We also had shots of the care package that initially Canadian officials gave to you. What is the relationship, the ongoing relationship, like with the Canadian Embassy?
The relationship with the Government of Canada is wonderful. We have two-person councils from the Canadian Embassy in Tokyo. We're in contact with them daily in WhatsApp. Yesterday, a team came here. They could not see us because we're quarantined. Apparently, there are about 12 Canadians here, and they brought more care packages with them. But more important, they emailed today to tell us the protocol that we have to follow in order to get released from the hospital. The first one is we have to get, as I mentioned before, 2 negative results. Then we have to get a certificate of health from the hospital showing this. Then we have to sign a form for the Canadian Embassy, which we sign and then send to them. And then finally, the fourth step, they will give us a certificate of health from the embassy, and that allows us to fly home.
That's a lot. I'm listening to you as you tell us all of this, and obviously it's an ordeal. But you seem to be really taking it well in stride, Larry, as I look at things, Craig.
Well, my friend Larry, who is on the floor below me, is constantly talking to me through WhatsApp. And fortunately or unfortunately, I cannot receive emails. So every morning, people email Larry, and then he reads me the emails, and then I respond to them. Today I got 12 emails, and I answered about 5 of them, and also one from the insurance company. So because of this fault that I can't use my iPhone for emails, it helps Larry and I pass the time.
I was going to ask you how you're passing the time, and I was also going to mention Larry, which is why I actually inadvertently referred to you as Larry, your traveling companion. When you were taken off that ship, he was allowed to come with you, not to stay on the same floor, but he's 1 floor below you, John was telling us. He has not tested positive at all, but how is he doing in all of this?
He's fine, but they are confined to the rooms on the 4th floor because someone down there was found positive. So they don't want it transferred to anyone else. So he's confined to his room, and I guess for the last 3 days. They're also testing him, so he's waiting for 2 results as well on the negative things. Yeah.
Craig, I know you are an elementary school teacher. You've probably dealt with lots of challenging situations in your professional life. How does this one rate in terms of a personal experience for you?
Well, it's a learning experience. People keep emailing me and saying I'm so positive. I really wish I was negative so I could leave. I keep my patience and I keep busy. I have an ebook. I just started a novel. It's called American Soil. No, Dirt.
American Dirt. Oh, that's a really hot one here at home too, Craig.
Oh, yeah, I just started it. And this is one of my contacts through home. I have an e-reader and we share novels. So a friend recommended this. So I emailed another friend who was the e-reader person. And lo and behold, it appeared on my e-reader today. So I'm on page 30 right now.
I think he's going to get lots of emails maybe after our conversation. I have a couple of quick questions. Can I just clarify something, Craig? Even though Larry didn't test positive initially, he too has to have 2 negative tests before he's let out and to come home with you?
Yeah. Yeah, because the incubation period for the coronavirus is such that he could have gotten it before he left the ship and it wouldn't show up right away.
Yes. Okay.
So they have to make sure that we don't come home with any chance of us infecting anybody.
All right. We'll hope for good results from him as well. Here's my question based on the news today. I don't know if you're hearing anything about this, but you know, we're reading at home. There's a top Japanese health official, Craig, who today is admitting that the Japanese response, in his words, was not perfect in terms of how they handled the Diamond Princess situation and the quarantine, in that passengers like you were quarantined, but the crew was not. So a lot of the crew became sick, and maybe that was partly how it was spread. So he's admitting some failings on that part. As you sit there reflecting on everything that you're going through, what are your thoughts on how they handle things from an official perspective?
Well, there were 3,700 souls on that boat. I don't know where in the world you would be able to isolate that many people on land. So I think they did best they could. The Ministry of Health for Japan took over the whole series of decisions that had to be made. I think they did as much as they could with what they had to work for. This is unprecedented. Hasn't happened before. And I'm sure there mistakes were made. But as the time went on, the quarantine went on, things changed. For example, whenever we answered the door, we had to have our masks on. The crew had to have masks on all the time when they were in the hallways. They also were there giving hand sanitizers when we went for our walks, and they were masked then as well. So I don't know. I don't want to fault the Japanese government. I think they did whatever they could in very unusual, unprecedented circumstances.
Craig, last question for you, and we'll let you get back to your e-reader and your emails back and forth. It's been a long ordeal. It will continue to be so until you get those 2 negative tests.
Yeah.
What are you missing most about Canada?
Being home, belonging to my band, belonging to my choir, being with my wife and son, having the freedom to get in my car and drive and get groceries or go to Tim's or meet friends for coffee, that sort of thing. We're stuck on the 5th floor. There's no way we can leave. I don't even have access to the elevators or the stairwells. So I miss the freedom, and I miss being home. There's nothing like home for the heart.
You know what, I'm betting that family members, choir members, band members, friends watching this conversation this morning, they're going to be super glad to see you looking as well as you do and telling us that you feel well, which is great. Looking forward to seeing you when you get home. Craig, thank you so much, and our best to Larry as well.
I will tell him. Thank you, Heather. Thank you, John.
All the best, Craig. We'll talk to you soon, we hope.
Craig Lee. Hopefully,
Okay,
2 days from
now.
now, 2 negative results as we speak to Craig Lee.
Let's hope.
Let's hope in Japan.